There are 7 drinks a person over 60 can consume before bed. That research shows calm an overactive bladder, reduce nighttime urgency, and improve sleep quality often within 2 to 4 weeks. Most people dealing with nighttime bladder problems have never heard of most of them, not because the research is new, but because nobody ever explained the connection between what you drink, your bladder's overnight behavior, and how you sleep. Stay with me because drink number 5 is the one that surprises almost everyone, and it's probably in your kitchen right now. And drink number 7 is the one I consider the most powerful of all. My name is Dr. Nyra Harrison. I specialize in senior health and preventive wellness. Today, I'll walk you through all 7, what each one does, why it works, when to drink it, and how to prepare it. Subscribe and turn on the bell. I share content like this every week. And drop a comment telling me which bladder symptom bothers you most at night. Urgency, frequency, waking multiple times, or trouble falling back asleep. Asterisk, asterisk. The foundation, asterisk, asterisk. Your bladder and your sleep are not 2 separate problems. They're one interconnected cycle. An overactive bladder wakes you at night. That disrupted sleep lightens your sleep architecture, making your brain more sensitive to bladder signals, even mild ones. That broken sleep makes your nervous system more reactive the next night, sending urgency signals more easily. The cycle deepens. This cycle has nutritional components, specific deficiencies, inflammatory states, and hormonal imbalances that either feed it or calm it, depending on what you consume consistently. The 7 drinks below each target a specific mechanism, but together they create an environment that supports bladder calm and sleep depth at the same time. Asterisk, asterisk. Drink 1. Warm water with magnesium, asterisk, asterisk. Magnesium is arguably the most important nutrient for this combination. An estimated 70 to 80% of adults over 60 are deficient without knowing it. Your bladder is a muscle regulated by the balance between calcium, which causes contraction, and magnesium, which causes relaxation. When magnesium is low, the bladder becomes more likely to contract, spontaneously producing sudden urgency even when it isn't full. Magnesium is also essential for GABA production, the calming neurotransmitter the brain needs to enter deep sleep. Without it, you spend more time in lighter sleep, where bladder signals are more likely to wake you. The most practical form is magnesium glycinate, dissolved in warm water 30 to 60 minutes before bed. Food-based options include pumpkin seed powder and dark cocoa, covered below. Always check with your doctor first, especially if you take blood pressure, heart, or kidney medications. Asterisk, asterisk. Drink 2. Tart cherry juice diluted and timed. Asterisk, asterisk. Tart cherries are one of the few natural food sources of melatonin, the hormone that initiates sleep and naturally declines with age. But the bladder connection is less known. Tart cherries are rich in anthocyanins, antioxidants that reduce inflammation in smooth muscle, including the bladder wall. Chronic low-grade inflammation there contributes to bladder hypersensitivity, so reducing it lowers baseline reactivity. A study in the European Journal of Nutrition found regular tart cherry juice reduced inflammatory markers alongside better sleep duration and quality. Caution: undiluted juice is acidic and can irritate the bladder. Dilute 1 part juice to 3 parts water and drink it no later than 2 hours before bed. If you have diabetes or prediabetes, discuss the sugar content with your doctor. Asterisk, asterisk. Drink 3. Chamomile tea, asterisk, asterisk. Chamomile works 2 ways. First, it contains apigenin, which binds to the same brain receptors as anti-anxiety medications, producing a gentle calming effect without dependency risk. A calmer nervous system means a calmer bladder overnight, since the sympathetic nervous system and bladder urgency are directly linked. Second, chamomile has a direct antispasmodic effect on smooth muscle, including the bladder's detrusor muscle, reducing involuntary contractions that cause urgency. A study in phytomedicine found chamomile extract significantly reduced bladder muscle contractility within 4 weeks of daily use. Use 2 tea bags for a therapeutic concentration. Steep covered for 10 to 12 minutes, and drink warm 60 to 90 minutes before bed. Asterisk, asterisk. Drink 4. Pumpkin seed milk, asterisk, asterisk. Pumpkin seeds are rich in zinc for bladder muscle tone, omega-3 seconds, anti-inflammatory, phytosterols shown to reduce overactive bladder symptoms, and magnesium. A study in the Journal of Traditional and Complementary Medicine found adults who consumed pumpkin seed extract daily for 6 weeks had 40% fewer nighttime waking episodes and less daytime urgency. Blend 2 tablespoons of raw pumpkin seeds with 1 cup of warm water. Strain if you like, and drink it about 90 minutes before bed. Add honey or cinnamon for taste. Give it 4 to 6 weeks before evaluating results. Asterisk, asterisk. Drink 5. Corn silk tea. Asterisk, asterisk. Corn silk, the fine threads around an ear of corn, has been used for bladder health for centuries. It contains flavonoids, particularly mason, with anti-inflammatory and antispasmodic effects on the urinary tract, and compounds that support the bladder wall's integrity. A study in evidence-based complementary and alternative medicine found corn silk extract significantly reduced urgency, frequency, and nighttime waking in older adults after 4 weeks, with no significant side effects. Steep 1 to 2 teaspoons of dried corn silk in hot water for 10 minutes. Drink 1 cup in the morning and 1 in the early afternoon, not the evening, since it has a mild diuretic effect, best used during waking hours. Asterisk, asterisk. Drink 6. Warm, unsweetened cocoa. Asterisk, asterisk. Pure, unsweetened cocoa has the highest flavanol concentration of nearly any food. Cocoa flavanols stimulate nitric oxide production, which relaxes blood vessels and improves blood flow to the bladder wall, reducing the tissue stress that contributes to inflammation and hypersensitivity. A meta-analysis found significant relaxant effects on involuntary smooth muscle contraction, beginning within 2 hours of consumption. For sleep, cocoa contains theobromine, mildly calming at these low doses, and tryptophan, a precursor to serotonin and melatonin. Mix 15 to 20 grams of pure cocoa powder into warm water or unsweetened milk. Use stevia or monk fruit instead of sugar or honey, since evening blood sugar spikes disrupt sleep. Asterisk, asterisk. Drink 7. Valerian root and passionflower tea. Asterisk, asterisk. This is the one I consider most powerful because it addresses the nervous system mechanism underlying the whole bladder sleep cycle directly. Valerian root contains valerianic acid, which slows the breakdown of GABA in the brain, supporting deeper sleep and reducing the brain's overnight sensitivity to bladder signals. A Cochrane review found valerian improved sleep quality and depth in adults over 60 with 4 to 6 weeks of consistent use. Passionflower binds to GABA receptors directly and reduces sympathetic nervous system activity, which is directly tied to bladder urgency. A study in phytotherapy research found passionflower tea before bed significantly reduced nighttime waking, with improvements in anxiety and restlessness within 1 week. Steep 1 teaspoon each of dried valerian root and passionflower in 2 cups of hot water, covered, for 15 minutes. Strain and drink warm 60 to 90 minutes before bed. Valerian and passionflower can interact with sedatives, anti-anxiety medications, and some blood pressure medications, so check with your doctor first. Asterisk, asterisk. A quick story. Asterisk, asterisk. I had a patient, Susan, 67, who'd been waking 3 to 4 times a night for 2 years. She'd tried fluid restriction, medication that left her mouth too dry to sleep. Going to bed later, nothing worked consistently. Once we identified the bladder irritants in her evening routine and built a protocol using several of these drinks, she was down to waking once a night within 3 weeks and sleeping through most nights by week 6. Asterisk, asterisk. Putting it together. Asterisk, asterisk. Morning and early afternoon. Corn silk tea, 1 cup each. Early evening, at least 2 hours before bed. Diluted tart cherry juice, 60 to 90 minutes before bed. Chamomile, pumpkin seed drink, or cocoa rotate as you like. 30 to 60 minutes before bed. Magnesium water, every night. 45 to 60 minutes before bed. Valerian and passionflower tea, especially on rough nights. 3 rules. Stop drinking at least 60 minutes before bed so you're not adding to your overnight fluid load. Don't expect results in a few days. Most of these need 3 to 6 weeks of consistent use, and treat these as one part of a broader approach that includes fluid timing and sleep environment changes. What you drink before bed is a significant, modifiable tool that most people with an overactive bladder and disrupted sleep have never systematically used. Start with 1 or 2 of these. Give each a few weeks, and keep a simple log of your nighttime waking so you can see the change build. If this was useful, subscribe and share it with someone dealing with nighttime bladder urgency. Tell me in the comments which drink you'll try first and how many times you're currently waking at night. I'm Dr. Nyra Harrison, and I'll see you in the next one.